So we're going to move on to our last exercise. I think it's our last exercise. I've already mentioned ethnography. I'm not going to go, there's not an exercise associated with that. It's just to say stopping and just observing, incredibly powerful. I think that's, yes. Okay. So this one, this is how this is going to work. We're going to need a group of about 10 people. And what we're going to do is we're going to have that group of 10 do the exercise, and the rest of you are just going to watch. Otherwise, it gets so noisy. And if we all do the exercise, it's going to be so noisy that we won't be able to hear anything of what goes on. So I'm looking for a volunteer. Let me tell you how this works before I get you to volunteer. I'll be nice about it. The way Wise Crowds works is it forces you to listen, and it allows people the freedom to discuss your problem without you influencing them. And so let me give you an example. I'm just going to walk over here, but I'll yell. Hopefully the mic will pick me up. Let's say I'm sitting with you guys, and I say, I have a problem with my physicians. They don't clean their hands. I'm sure you all have that problem. Anyway, they don't clean their hands, et cetera, et cetera, et cetera. I need some help. When you start giving me advice, I'll make all sorts of movements like, yeah, you know what, I already tried that. Yeah, no, they won't listen to that. I start shooting down your ideas, partially because I may have tried that, partially because as a leader, I may feel uncomfortable admitting that I didn't try something. And so in the end, I basically kill the conversation. I'm not listening to your advice because I'm not really asking for your advice. So the way Wise Crowds works is, I spend a minute telling you my problem. You don't get to comment on it, you just listen to what I'm saying. At the end of that, you have 2 minutes or so to ask me questions. So to make sure that you understand what my problem is. But you're not trying to solve it yet. Remember the what, so what, now what. You're not trying to solve my problem, you're just making sure you understand my problem. Then what I do, this is the fun part, I take my chair, I don't face you anymore. You discuss my problem like I'm not here. And I'm not allowed to do this or shake my head. I just sit with a piece of paper and I write down what you say. I'm just writing down your ideas. Okay, so I'm not in the room anymore. I'm just sitting here, you're discussing me like I'm in another country. I'm not here. After about 5 minutes or so, I turn around and we have a conversation about what I heard. I have seen this work unbelievably well, especially often with senior leaders who were kind of trained to not admit that we don't know something. And so this structure forces you to listen to other people and not influence what they're saying. So does anybody have a problem? They would like to be the Wise Crowd person sitting in the chair I was in. Might as well, you guys okay with being the group that discusses it? There's no pain or anything involved, you just discuss it. Okay. We can add a few more people to get a bit more oomph to the group if you want. Anybody have a problem they want to discuss? The other facilitation technique I'll mention is that I can stare you down. When I learned how to do this work, it was trained sort of wait 20 seconds. Somebody inevitably will say something within 20 seconds.
My problem would be
So basically, in a minute or so, we'll keep this group as it is. Once you guys have finished, I'll ask the larger group if you have any other things you want to add in, okay? So keep it that way. So you have a minute or so to just describe your challenge to the group here. And you guys just listen. Okay, so the trick with this is you're not engaging with them at all. So, gang, start discussing the possible solutions to this and speak loudly so everybody can hear you. And then once you've done a bit, I'll invite others from around the room if you want to jump in. So what did that feel like when
It was
they're...
good. It was good, but I wanted to sort of answer.
Yeah,
And it was
absolutely.
good having my back to it because I felt I couldn't answer.
Which was on purpose, right?
Yeah.
Because we're
Yeah.
purposefully stopping you from stopping the conversation. It's very hard.
Yeah.
I've seen people squirm in that seat because they so want to say something.
Yeah.
But then it was interesting how the conversation we got into, maybe we should empower our patients, and then it leads to maybe we shouldn't empower our patients, and you realize this is a really complex issue. And you know, sometimes you get a very clear answer that comes out of this, sometimes you don't. Sometimes you realize how incredibly complex this is, and there's no easy way forward. I really like it. It feels artificial, like you're really making this an artificial conversation. It's even more artificial because you're all around the room and it's sometimes hard to hear. But you can imagine with a group of about 10 people, where one of them's struggling with a problem, next time, because you're going to probably experience this tomorrow when you go back to work. Someone's going to tell you a problem, and think about how you yourself, you're shutting down or they're shutting down the conversation because they're already stopping you before you get started. And try it. It's very neat when you try this and you see it for yourself, how well it can actually work. So that's wise crowds. I leave you with this quote: insanity is doing the same things over and over again and expecting different results. That's that rigidity trap, where we just get stuck in doing the same things. And so the techniques we learned today, and tomorrow, if those of you that are at the conference, you'll hear me speak about more sort of the theoretical background around these, and also some more stories about how we've used them for a variety of patient safety things. But for today, it was really about teaching you these techniques. So we learned speed networking. Next time you're holding a meeting with people, why don't you write the topic on the thing and have them just talk to each other for 5 minutes? They can run the meeting for you. You just sit back and scribe what they're saying, right? We learned TRIZ. How do we kill everybody in this hospital? Which of these things are we currently doing, and which things do you want to start working on today? We learned about the concept of the 15% solution. Most of things are out of your control, but there's always some aspects of that TRIZ exercise that you own. If you're trying to prevent patient falls and you're the housekeeper and you're leaving the floor wet, you own that. You could do something about that. You could bring their walker back to the side of the bed when you leave the clean room so they don't fall when they're trying to get their walker. You own some of that. Right? We then learned about 1, 2, 4 all. Think on your own, pair up, pair up. We then moved on to the eco cycle. But we also did what, so what, now what, that concept of think and engage before you take an action. Now, I'm not suggesting in the middle of a cardiac arrest that you all hold hands and sway and talk about how you feel about this cardiac arrest. Yeah, maybe it would be a good idea because, yeah, that gets into the end-of-life care thing. But there are ample opportunities in what we do every day to stop and think and engage people. Let it percolate a bit, and you may get a very different answer. We then did EcoCycle, and we finished off with Wise Crowd. So these are 6 or 7 different techniques. They're all on liberatingstructures.com. And the hardest part with these techniques is to actually use them. Because people hear this, they think it's really cool, and then they go back to their place of work, and it feels so foreign to do something like this. All I can suggest is just get in there. Just try it. Usually start with TRIZ. It's the one that seems to be the one that people enjoy most. And just start there and see where it leads. You have no idea where it's going to go. And that's frightening, but you just got to let it go and just see where it leads you. So I'll leave us there. If you have any final questions, happy to take those. And I'll stick around for a bit if you have any, those of you that are afraid to ask your questions in front of the group, I'm here. So thank you so much for coming.